Hello my dear students, welcome on the new session of psychiatry. On this session, we are going to discuss the models of psychotherapy, the various types of psychotherapy which are applied in clinical psychiatry. The models of psychotherapy include three main types of psychotherapy. The first one is called Psychoanalytical Therapy, the second one is Behavioral Therapy, and the third one is Other Therapies. Psychoanalytical type of therapies involve various methods, various different methods. So we need to go into the details. Let's have a look at the slide. Psychoanalytical therapies are based on the history and the past of the patient, whereas the behavioral therapies are based on the learning mechanisms. You need to remember this very important difference between psychoanalytical and the behavioral therapies. To repeat, psychoanalytical therapies think of the history of the patient and the past of the patient, and the behavioral therapies, they are based on the various learning mechanisms. And the third type of psychotherapy is the other therapies, all the various other therapies, which we'll discuss when we come to that slide. Psychoanalytical therapies, the first type of psychoanalytical therapy is called psychoanalytical and related therapies. And so there are some very important prerequisites to start or to apply this type of therapy. The patient has to be intelligent. For this, patient has to be flexible, and patient needs to be a non-psychotic patient. If the patient suffers from any kind of psychosis, psychoanalytical and related therapies cannot be applied. Next, the patient has to tolerate the negative emotions like anger and guilt. The patient has to be compliant to maintain the ongoing follow-up with the therapist, because it's going to take a long time, and the patient has to have a desire to gain insight. Usually young patients respond well to this therapy, less than 40 years of age. The patient needs to be honest, and the patient should not be suffering from antisocial personality disorder. The next important practical prerequisite is the patient needs to have a stable life situation, and the patient needs to have time, and the patient needs to have money to spend, because this is going to take a long time. Psychoanalytical therapies are divided into four types of therapies. Number one, psychoanalytical and related therapies. In this, the physician does not face the patient. The physician does not face the patient. It's not across the table. The patient is lying down and the physician is facing something else, somewhere else, and is talking to the patient. This is a long-term therapy. 4 to 5 sessions are required every week, and this may go on for years. And the four types of methods which are used under psychoanalytical and related therapies is free association. The physician makes the patient talk, and the patient freely talks. The second one is dream interpretation, interpretation of the dreams of the patient. Next, analysis of transference is the various emotions the patient is likely to transmit to the physician. The physician analyzes those emotions. And the last one is analysis of resistance, is trying to analyze what are the things the patient is trying to resist and the patient is trying to hide. So these are the four methods under psychoanalytical and related therapies. The second one is psychoanalytically oriented psychotherapy. This is a brief method, and it's a direct communication, and here the physician faces the patient. These are useful for obsessive compulsive disorder, OCD, for conversion disorders, for personality disorders, and for dysdymic disorders. The third one is called brief or short-term dynamic psychotherapy. And here you have one session per week, that's weekly, lasting for about 12 to 40 weeks. One session per week, 12 to 40 sessions. And this is for dealing with the current life stressors, the current problem situations in the life of the patient. The last one, fourth one, is interpersonal therapy, and this deals with the interpersonal relationships specifically. Again, there is weekly session, one session every week, and it lasts for just 12 to 16 weeks. So have a look at this slide, review it once again. The various psychoanalytical therapies. The first one, psychoanalytical and related, is longest, may take years, and there are four types: free association, dream interpretation, analysis of transference, and analysis of resistance. And in this, the physician does not face the patient. The second one, psychoanalytically oriented psychotherapy, is a brief communication. It's direct. The physician faces the patient, and is useful for OCD, conversion disorder, personality disorder and dysdynamic disorders. The third one, brief or short-term dynamic psychotherapy, weekly, lasting about 12 to 40 weeks, just to deal with the current life-stressing situations. And the last one, interpersonal therapy, weekly one session lasting 12 to 16 weeks, and it is specifically to deal with the interpersonal relationships. So that's about the psychoanalytical therapies. Now we go to the behavioral therapies, and as I showed you here, this was psychoanalytical based on the history and the past. This is behavioral. Let's come to the slide. The behavioral therapies are based on the learning mechanisms. I hope you remember there are two types of learning mechanisms. One is classical learning and the second one is operant learning. So if you look on this slide, what are the methods based on classical learning? Number one is called systematic desensitization. And this desensitization, a gradual systematic desensitization, is required in the management of phobias. The second one is called aversive conditioning. Aversive is bad, aversive is harmful or noxious. Attaching an aversive or noxious stimulus with a particular behavior or habit of the patient, and this is especially useful in conditions like alcoholism, that's addictions, in conditions like paraphilias and the maladaptive habits. So that's aversive conditioning. So systematic desensitization and aversive conditioning is based on the classical learning. Based on operant learning or trial and error learning, you have three various mechanisms. Flooding and implosion is useful for phobias. Token economy is useful in conditions of autism or mental retardation to encourage the good behavior from the patient, to encourage the desired behavior from the patient. Token economy. And the next one is biofeedback, which is useful for chronic physical disorders in which the patient himself can monitor what's happening to his investigation, what's happening to his examination, and can learn through the operant mechanism. The sixth one shown here is cognitive behavioral therapy, and this is useful for mild to moderate unipolar non-psychotic depression. So this is mainly useful in depressive disorders, which is mild to moderate, is also useful for anxiety states, and is useful in major depression many times along with the antidepressant drugs. This cognitive behavioral therapy again has a weekly session lasting for about 12 to 25 weeks. So this is about all the behavioral therapies which are based on learning mechanisms. I would like to advise you to have a look at this particular slide once again, and you have to pick up the important type of therapy for a particular type of illness, for a particular type of condition based on the method of learning. For example, you may be asked, a patient with alcoholism or addiction is treated with aversive conditioning. This particular therapy is based on which particular mechanism of learning? The answer will be classical learning. So I just gave you a training how to remember it, and these are the things, important things you need to remember. Flooding and implosion, token economy and biofeedback based on operant conditioning, and systematic desensitization and aversive conditioning based on classical learning. So this is regarding the behavioral therapies. Next we go to other therapies. Other therapies are useful in specific situations to solve the specific life stress and problems. For example, there's group therapy, there's leadership group therapy. Next one is family therapy, when many family members have to be involved. Marital and couples therapy, that's very important. Next is sex therapy for various sexual disorders as well as various other psychological disorders. Supportive therapy, and as you know, stress management. That's a very important issue. So these are all the other types of therapy. So we went briefly through all the models of psychotherapy, we classified them, and we tried to look into for what particular condition it is useful, and it's based on what principle. I hope the module was short enough, it was brief, and it gave you all the detailed information which you need to face the various entrance examinations as well as other examinations. I am sure this module is going to be useful to you, and make a good use of it. Wish you good luck. Thanks for listening.